AAPC NOV 2025 CEUS. Which of the following statements is NOT correct? A. Organizations using AI are responsible for ensuring that the output of AI generative tools is auditable. B. AI coding can eliminate the chance for False Claims Act violations. C. AI can help when trained with clinical context and updated regulatory standards. D. Internal policies are essential for governing the ethical use of AI. Which of the following statements about billing is true concerning medical practices participating in the VFC program? Providers may bill for vaccines only. B. Providers may bill for a vaccine and its administration. C. Providers may bill for administration of a vaccine only. D. Providers may deny a child a vaccine if the family cannot pay. Which of the following documentation statements might I misinterpret? A patient denies shortness of breath. B. Family history of diabetes. C. Reviewed by physician. D. All of the above. A female patient has two lesions suspicious for malignancy, thyroid and cervical regions. FNA is used for the thyroid lesion under the guidance of ultrasound to determine its character. Another FNA of the cervical lymph node is then performed, also with ultrasound guidance. What is the code for FNA with ultrasound guidance for a single lesion? A 10,005B, 10,006C, 10,007D, 10,009. Which military engagement did veteran Brian Boyce serve in? A. Vietnam War. B. Desert Storm. C. Lebanon. D. Afghanistan. A female patient has two lesions suspicious for malignancy, thyroid and cervical regions. FNA is used for the thyroid lesion under the guidance of ultrasound to determine its character. Another FNA of the cervical lymph node is then performed, also with ultrasound guidance. What is the code for the subsequent FNA of the cervical region using US? At 10,007-52B, 10,004C, 10,005-59D plus 10,006, which modifier should be appended to CPT EL code 91,065 when the physician only interprets the test. 26B TCC 3359. When using a hydrogen breath test, which sugar is typically used to test for SIBO? A. Sucrose. B. Glucose. C. Fructose. D. Lactose. Which of the following is one of the three trends shaping the coding services landscape this year? A. Lower denial rates. B. An abundance of trained and credentialed medical coders in the United States. C. A shift from provider perform coding toward professional coders and outsourced services. D. None of the above. Which type of pancreatic cancer may be malignant, precancerous, or benign? A. Endocrine nephritis. C. Islet cell tumors. D. All of the above, true or false. If a patient has both Medicare and a cost sharing plan, the patient is not required to submit a Medicare explanation of benefits to the cost sharing ministry. A. True. B. False. Which of the following is the best course of action for a professional medical coder who has a question? A. Always rely on a more experienced coworker's advice. B. Base your coding on EHR suggestions. C. Use official coding guidelines and reputable sources to do research. D. Wait for audit feedback to learn whether your work was incorrect and why. Which of the following is an OT a risk associated with inaccurate medical coding? A. Denials and revenue loss. B. Increased staffing requirements. C. Compliance violations and legal consequences. D. Poor clinical insights and patient outcomes. Accurate billing of drug eluting sinus implants must include which information when the payer is Medicare? Exact dosage administered. B. And DC and units. C. And DC and exact administered. D. Name of drug and DC and exact dosage administered. How does AI contribute to denial prevention in medical coding? A. By auto-generating provider notes. B. By flagging high-risk codes using historical denial data. C. By assigning final codes without human oversight. D. By bypassing payer-specific rules to expedite claims. What may be the result of cloning a note from a prior medical visit? A lower denial rates. B. Inaccurate medication lists. C. Better provider interactions with patients. D. Better financial outcomes for the practice. A 6-month-old infant comes in for their routine well child visit. During the visit, they receive their third doses of DTaP diphtheria, tetanus and pertussis, Hib Haemophilus influenzae type B, IPV inactivated polio vaccine, and hepatitis B via the Vaxilis brand combination vaccine. They also received their third doses of PCV pneumococcal conjugate vaccine and rotavirus vaccines and their first influenza and C. COVID-19 vaccinations. The provider documents that counseling was given for each vaccine. What is the product and administration coding for the DTIPIP, VHIB, each EPB vaccine? A 90,000, 697, 90,460 x1, 90,461 x5 B, 90,000, 697, 90,471 x1 C, 90,000, 697, 90,000, 460 D, 90,000, 697, 90,000, 460, 90,000, 461 x4. When a patient has a cost sharing plan, who is responsible for paying provider for medical services rendered? A. The cost sharing ministry. B. The patient. C. The medical facility. D. The insurance company. Which of the following statements is false concerning pancreatic cancer? A. Jaundice may be a symptom of pancreatic cancer. B. The combined 5-year survival rate for pancreatic cancer is about 11 minus 13%. C. Pancreatic cancer is most often detected in the early stages. D. Pancreatic adenocarcinomas form when the cells that produce digestive juices grow out of control. Which is the correct device code for a drug eluting sinus implant when the payer is Medicare? A J3490B, S1091C, J7402D, 31299. Thank you for watching my video. Please like and subscribe.